This week, a rescue plan for HCMC takes shape with some money for other hospitals as well, and the feds are freezing yet more Medicaid funding for Minnesota. Welcome to the May 1st edition of Healthline, the weekly news podcast from the Minnesota Hospital Association. I'm Tim Nelson.
And I'm Abby Mocktig.
The Minnesota Senate passed a $150 million rescue plan for HCMC this week, offering $50 million this year and double that in 2027 to shore up the hospital's faltering finances. Senate Health Committee Chair Melissa Wickland said it was making the best of a bad situation, citing shortfalls in federally funded programs like Medicaid and Medicare.
We are addressing immediate risks. We are doing in the short term what we can to protect essential services. And we're trying to live up to our values, which is that people should have access to health care.
The bill also has $114 million next year for what are being called hospital stabilization grants and another $17 million for safety net provider grants. The bill passed in a party line vote, with Republicans insisting that Hennepin County was partly to blame for the HCMC crisis. Senator Tori Westrom singled out hospital governance and diversity and environmental initiatives as contributing to Hennepin Healthcare's financial woes.
Stop this track of DEI, social and climate justice that has become such a big policy that they have spent tens of millions of dollars on at HCMC and continue to, while they are going broke at the expense of all the patients across the state.
But over in the Minnesota House, Jan Malcolm, former health commissioner and now special advisor to Governor Tim Walz, told a House Health Committee hearing this week that Hennepin Healthcare's struggles weren't unique.
It's like we're all sort of in the same herd, all moving toward the same cliff. It's just that Hennepin already has a foot over the cliff. But really important to note that some of these macro trends, particularly the shift in federal policy, really is going to affect the whole sector.
The Minnesota House is still debating its own rescue plan for HCMC with three different approaches. They include a 1% county sales tax, which has faced even DFL resistance, as well as a one-time infusion from the state's cash reserves, and a GOP plan to dedicate some of the state's hospital surcharge proceeds to HCMC, and also require a major overhaul of the hospital's governance. Faith leaders today are wrapping up a 24-hour vigil in Minneapolis calling for lawmakers to support HCMC. Meanwhile, FBI raids at nearly 24 sites around the Twin Cities this week at autism support centers and child care sites prompted the Trump administration to announce it was freezing yet more Medicaid funding for Minnesota. Dr. Mehmet Oz said Thursday that CMS was freezing $91 million in payments to the state, citing ongoing fraud concerns. That's in addition to a previous $259 million freeze, which the state has been unsuccessfully challenging in court.
And a potentially significant court ruling in North Dakota this week. A federal judge ruled against the state's 340B drug discount program law that barred drug makers from restricting what eligible pharmacies could participate in the program. Minnesota has a similar law, but healthcare providers say drug makers ignore it. The Minnesota measure has survived initial federal court challenges similar to many other states, but the North Dakota decision may prolong the legal battle over the program.
A recent Minnesota Department of Health report said providers in the state get more than $1.3 billion in savings from the 340B program, a major financial lifeline for Minnesota hospitals. Also this week, hospital leaders from around the country were in Washington, D.C. for a House Ways and Means Committee hearing, a follow-up to a January hearing featuring health insurance company CEOs. Ellen Florek has more.
Members of Congress have been calling out healthcare affordability for months and bringing industry executives to Washington to face a public grilling. Hospital CEOs were before the Ways and Means Committee on Tuesday and got a tongue lashing from GOP Chairman Jason Smith of Missouri.
This committee isn't interested in hearing about how the high prices your businesses charge are somehow someone else's fault. The blame game didn't work with insurers, and it won't work today with us. Simply put, hospitals are charging an insane amount for care. Hospital prices have skyrocketed 300% in just over 2 decades, more than any other sector.
Smith said hospitals with more than 100 beds were more profitable than Delta Airlines, Target, or Disney, although he didn't make any distinction between for-profit and non-profit healthcare. Hospital executives told the panel that aging patients, growing acuity, and rising workforce costs are driving up prices. One said that administrative costs, like prior authorization applications, are eating up as much as 20% of hospital budgets. Democrats call the Republican criticism a distraction from the financial peril looming from federal health cuts in last year's One Big Beautiful Bill Act.
That hearing, by the way, came as a new survey from KFF reported that healthcare costs are at the top of Americans' lists of worries, matching concern for gas prices among poll respondents in a survey last week. And before we go, a major biotech company said this week it's about to finish its $110 million pathogen-free pig farm near Stewartville that will double the capacity of its organ manufacturing program. The Rochester Post-Bulletin said Maryland-based United Therapeutics hopes to have FDA approval for pig-to-human transplants by the end of this decade, a possible lifeline for patients with end-stage heart and kidney diseases. That's it this week from Healthline, a weekly news podcast from the Minnesota Hospital Association. I'm Tim Nelson.
And I'm Abby Mocktig.
Thanks for listening.